Welcome everybody to How to Case Present in 2012. This is Curtis Marshall with Procore. We are excited to have everybody on this webinar. Tonight we will be going over both KPIs, which are key performance indicators, and how to case present and the tie-in between the two. At this time we do have Rob Bay, who has presented to many different organizations and individual offices, and we're excited to have him on tonight. So without any more delay, we'd like to invite Rob to join on. Rob, are you there?
Yeah, I am. Thanks, Curtis.
You're welcome.
And I'm really glad to be with everybody today. This is an exciting topic. Curtis, appreciate your getting us started. Again, as Curtis mentioned, my name is Rob Bay. I'm with Procore. We're a certified public accounting firm, a group that works specifically with physicians and dentists nationwide. Probably about 70–75% of our business is in working with dentists. And we're a firm that takes a very proactive approach with tax strategy, accounting information, as well as your practice information to put dentists in the best possible financial position. We see most dentists pay far more in tax than they need to, as well as are not really optimizing their practice and getting really out of it what they possibly can. And in doing that, a typical dentist will leave well over $1 million on the table over their career. So we put together strategies as well as financial plans, and by doing that, the average dentist that we work with increases their profitability by 15%, their profits, I should say, by 15%, as well as saves about $23,000 a year in tax. So this webinar will probably go for about 30 minutes, and we'll get right to it. The first question really that I have in talking with a dentist is finding out if their practice is financially healthy. And in looking at if your practice is financially healthy, there's typically three main things to consider. And this is when we work with a dentist. We like to measure things. We like to look at things. And if your practice is financially healthy, this is how you'll know. There's three things to consider, three things to look at. The very first one is what is your annual revenue per active patient? And we consider an active patient to be a patient that you've seen in the last 18 months. And if you take your annual revenue, and by that I mean collections, not your production, but if you take your collections and divide that by your active patients, you should be close to $800 to be a practice that's financially healthy. Most dentists, when we first start talking to them, are in the range of about 500 or so, which means that it tells me that you typically have about 50% in additional collections or additional income that's available to you. We need to tap in and really get to that. We'll talk a little bit more about how you do that. But $800 is the number to shoot for. The second thing to look at in seeing if your practice is financially healthy is what percentage of your collections are you as the proprietor or you as the owner taking home. 45% or greater is the number to shoot for, meaning that your overhead is 55% or less of your collections. So that's the second thing to look at. Both of these, if you're in line, then great. If you're not in line, then there's things that we can look at and measure that are down below this level to be able to help get you to that point. The third thing to look at is if your income and lifestyle is in balance. And what I mean by that is, are you making the amount of money that you'd like to or that you should be making? And then also, is your lifestyle in line with what you'd like? I was talking with a dentist earlier today and asking him some questions related to these three areas. Most dentists, in asking them, don't really know what their annual revenue per active patient is. But this person had an idea of what their overhead was and what their owner's take was, and their owner's take was right around 20%. This is normal. I see this all the time, 20, 30%, but 45% plus is really the number to shoot for. as well as this dentist, while they had $1.1 million in annual collections, was not making the amount of money that he wanted to, and was working 6 days a week from early in the morning till into the evening. His lifestyle was not quite in balance with where he'd like to be. So these are the things to look at. We're big believers in measuring things. Reason why is when you measure something, that ends up being the thing that you're focusing on, and the things that we focus on ultimately are the things that improve. So these are things to, as I mentioned here, to look at and to measure. Watch those on a regular basis. There's a quote I really enjoy, which is by Thomas S. Monson, that says, "Where performance is measured, performance improves. And where performance is measured and reported back, the rate of improvement accelerates." And so really this just goes to say that in anything, when you measure it, again, as I said before, you focus on it, and then those things ultimately improve. So if you're wanting to improve your collections, if you're wanting to improve your annual revenue per active patient, if you're wanting to improve your case acceptance rate, any of these things, if you're wanting improvement, you need to measure these things. And then additionally, if you want to accelerate that improvement, you need to find some type of a reporting mechanism. And so we'll talk some more about some of these things. All of these things are what we refer to as key performance indicators. And a key performance indicator is any bit of measurement that you can quantify that would contribute to your success, either is currently contributing to your success or would contribute to your success. There's potentially over 300 key performance indicators. There's a software company out there that focuses in key performance indicators and giving these types of measurements, and they say there's 390 key performance indicators that they have. It's really impossible to measure that many things and know which things are important if that's the case. Our belief is you should really have about a dozen indicators that you should be watching on a regular basis. And by regular, I mean looking at on a weekly or on a monthly basis. Some indicators you want to look at on a quarterly basis, and sometimes there's things to look at on a daily basis. But having those indicators available to you and watching and monitoring those will ensure your increased performance in those areas that are key to you. We really like to take those indicators and put them into a visual dashboard format. And by doing that, you're able to see at a quick glance what's happening and what's going on. This is the type of thing that we provide with the clients that we work with. Some of these key performance indicators, as I mentioned before, are annual revenue per active patient. Again, $800 is the benchmark or the number to shoot for. I really like to take this $800 number and then rather than looking at it annually, because if you only looked at this once a year, it's not going to do you a whole lot of good. But if you took at it and took this number and looked at it monthly, which is about $67 per active patient, and you looked at that on a monthly basis, that gives you something to look at. Or if you took this number and you looked at it on a weekly basis, it's a little over $15, $15.38 or 39 cents. Then you have something that you can look at on a regular basis and chart that out and see what's happening or what's going on within your practice. Another indicator, if you're in the mode of trying to grow or perpetuate growth, and I'm assuming that a lot of you are since you're on a webinar that's dealing with how to increase your case presentations or how to better your case presentations, is what percentage of those active patients that we talked about have a scheduled appointment. Now, most dentists that I talk to believe that the majority of their patients have a scheduled appointment. It's their policy that everybody, when they leave, they have a scheduled appointment, and so they believe that this number is much higher than what it really is when we actually look at it. But a lot of patients end up falling through the cracks. And by ensuring that you have a scheduled appointment with as many of your active patients as you possibly can, this will help you to reduce attrition, as well as be sure to catch issues as they come about, and allow you to be able to have something actually to present in a case. And another key area or metric to measure, a lot of dentists, and a lot of you, I'm sure, are spending money in marketing. And you're measuring how much money you're spending in marketing, and then you're also measuring what comes from that. How many patients, how much money is coming from that. Well, there's a whole lot of things in between that are contributing to that success of that money that's spent. When you're spending money in marketing, it's not producing dollars, or it's not producing patients. What it's actually producing is phone calls. And then what happens is they're calling into your office. You have somebody up at the front desk who's representing you. They're answering that phone call, and they are then converting that into a scheduled appointment, and then that person ultimately needs to show up, and then you need to present a case to them before that ever even turns into money. So if you had a marketing effort that was producing 20 new patients a month, and you may decide, oh, this is good, and this is worthwhile, or I'm getting a return on my investment, or I'm not. But you could have two totally different situations. If I told you that you spent X dollars in marketing, which produced 20 phone calls, and those 20 people all scheduled, and those 20 people who scheduled all ended up showing up for that appointment, that tells a totally different situation or different scenario than telling you that your marketing efforts produced 100 phone calls, 50 of those scheduled, and only 20 of those showed up. By watching and monitoring these key performance indicators, you can see what's really happening or what's going on. Is your marketing effort or that money that you're spending giving you what you want? Maybe it is, and you're losing a lot of patients in this area, which then tells you, okay, I can continue what I'm currently doing at the front desk and just spend more money, or I can spend more money, or the same amount of money, or possibly even less money, and improve this area and get the desired result that I want. So another key performance indicator to measure here. The key performance indicator that you probably had the most interest in and why you were here was case acceptance. There's a couple key things to measure here as it relates to case acceptance. One is how many cases do you present, and what's the percentage of those that accept? So I presented 5 cases, and I had four accept. And secondly, you're going to want to measure, I presented this amount in dollar volume, and this is what was accepted in dollars. The reason why it's important to measure both of those is a lot of times what we'll see is those two, if we looked at the percentages, are not congruent with each other. A lot of times what we see is a dentist will be at a certain percentage as far as volume of case presentations versus acceptances, but their dollar rate is at a lower percentage. And a lot of times this is telling us that something is happening when they're presenting larger cases. And sometimes, occasionally, we see the exact opposite. So watching both of those is going to give you some valuable information, and trending that over time, then you're able to make minor adjustments and see what happens, what is the effect. By having these types of key performance indicators in place and having a mechanism to be able to see these on a regular basis helps make running your practice a lot easier. You're able to focus more on the clinical aspect, where typically most dentists want to focus, and not be so stressed or worried about what's happening over here on this business aspect. Spending a little bit of time and setting these things up will really free you up to have your focus be on the clinical aspect. Makes your life a lot easier, reduces stress. So to get to the area that we want to spend the bulk of our time tonight on case presentations. Dentists in general are somewhat adverse to the word selling or sales. In case presentations, by most dentists are viewed as a sale. A lot of dentists do not want to feel like they are pushing their their patients. They don't want the patients to feel like, wow, you know, this dentist is just always cramming something, you know, down my throat about something I need to get done. And so dentists are averse to this perceived confrontation of case presentations. And because of that, they have preconceived ideas in their mind about what's going to happen, or about why people are not accepting treatment. And let's go to a poll, Curtis, about specifically about that.
That's great. Well, and I'm excited that we're going to be jumping into this case presentation information that you have, Rob. But first question that we want to post up here is, what is the true reason, and here it is, what is the true reason patients do not accept treatment? I don't want to know what they necessarily tell you, because what they often tell you isn't true reason. But if you wouldn't mind clicking here on any reason that you think that apply on reasons why patients do not accept treatment. Is it because they want a four-wheeler and they don't want to fix their crown? Is it because their kids want to get that new Nintendo? So that's something we want to start off with, to really get your mind thinking of why patients do not accept treatment. And Rob is going to take us away and really let us know a few reasons how to overcome these obstacles and to find out the true reason why patients do not accept treatment. Rob?
Thanks, Curtis. Now I don't know if you guys are able to see the results, and I apologize for not knowing that. But as typical, the number one reason is money, closely followed by they don't think it's necessary. Fear being the third reason that's posted on here. In general, most dentists, when I talk to them about case presentations, their natural thought or inclination is the reason why people do not accept the cases I present to them is because of money. They don't have the money, or they're going somewhere else, or you know, whatever reason. But money typically is the reason why I hear back from dentists about why somebody is not accepting treatment. And I want to give you tonight or today a reason why people will accept treatment other than money. People will accept treatment for one of 5 reasons. And everybody, humans in general, act in self-interest, their own self-interest. And when people accept treatment, it's going to be for one of these 5 reasons. And these are the same 5 reasons why anybody will act for you in asking them to do anything. And we've got these here in a way that makes it easy to recall or easy to remember, but we call these the 5 Ps. And these are benefits to them. And they are profit, pain loss, preservation, prestige, pleasure, as I'm sure you can see and read there. But if somebody is accepting treatment or acting for you in any way, it's going to be for one of these 5 reasons. Either it's going to save them money, make them money, it's going to reduce some pain, whether that is physical or it's some type of mental pain. It's going to preserve them, whether that's something about them as in their teeth, or preserve them from losing their job. They're going to accept it because of prestige, in that this is something that makes me look better to other people, or I'm going to feel cool because of this. Or they're going to accept it because of pleasure, and this is just the way that I feel about myself because of this. If somebody's accepting treatment it's going to be for one of those 5 reasons. Curtis, this isn't necessarily a poll. I guess it's maybe a little bit more of a quiz. But let's go back to you.
Absolutely right. So I hope you wrote those 5 things down. Those are very important. What we want to know is which of these 5 are not one of the 5 P's. Which one of these are not the 5 P's? I'm going to give you just a couple more seconds, and please write down all these P's. It looks like we have a few people who are picking some that are not correct. We'll give you 5 more seconds. And Rob, if you'll make sure to let us know which one is not correct, and so that they can write down, and which one to replace it with, so they can write that down, that'd be great. But thank you, everybody, for joining in on this poll.
Okay, looks like most people got this correct, but the incorrect one up there is professional. To recap again, those 5 P's are profit, pain loss, preservation, prestige, and pleasure. Those are the reasons why somebody will act for you. When you're involved in a case presentation, we need to start off with determining what our objective is in this case presentation. And really, when we're looking at it, our objective is to find out what their current situation is. We call this their status quo. And then what their desired position or their desired situation is, which we call their vision. And ultimately what we need to do, and what our objective is to be able to take those 2 and demonstrate to them the gap or the difference between what they currently have and what it is that they want, or what it is that they desire. And the way that we go about doing this is to be able to ask open-ended questions. And when we're talking about their vision, again, we're talking about this in terms of those 5 P's: the profit, pain loss, preservation, prestige, and pleasure. And so we need to be able to separate these. The way that we do this is we use what all of you probably would know, or if you studied in school, the scientific method, in that we have a hypothesis and then we test that hypothesis. So we need to go in and say, I'm going to suppose that the reason why this patient will accept treatment is because of pain loss and because of preservation. Or this patient, I believe, will accept treatment because of prestige and pleasure. And then we're going to test that hypothesis. The way that we test that hypothesis is we ask open-ended questions. These are not yes or no questions, but these are questions that require some thought from the patient. They frequently will start with questions like, with words like who, what, when, where, why, how, all the ones that you're familiar with. And again, we're going to ask questions initially about their status quo. Some of these open-ended questions regarding their status quo are going to sound like, how did this come about? What symptoms have you noticed? How often have you noticed these symptoms? What do you think, or what do you feel about your situation? What's the frequency or the severity, or what's been happening in the past to get you to this point? As we're asking them these types of questions, they will likely, in their mind, come to some conclusions. Some of these conclusions are things that they may not even have realized until they have the point where they're verbalizing them, what their current situation is, how it is affecting them. And then really what we want to do is, again, as we move towards the vision part of where it is what it is that they want or what they desire, and even in these status quo questions, we want to get a little bit more meaning. Now, you probably don't recognize this, but this is the logo for OPEC, which is the oil-producing countries of the world. When you're in a case presentation, this is what I want you to think of as OPEC. And the reason why I want you to think of OPEC is drilling down and getting to more meaning than the actual just basic what's happening. This OPEC stands for opportunities, problems, effects, and consequences. And what I mean by that is we're looking for opportunities, and then ultimately we're driving down to what are the effects if they were to be able to realize those opportunities, and then also what are their current problems, and then what are the consequences of those problems. So when we're asking questions regarding their status quo or their current situation, we want to ask them, how is it that this is affecting you? What's going on in your day? When do these symptoms manifest themselves? You know, how does that affect you in your employment? You mentioned your employment. It's affecting you there. How is it affecting you there? Those types of questions. And again, as we're asking them questions regarding their vision or their desired situation, and separating out again where they currently are from what it is that they want, we want to ask these same questions about what are the effects or the consequences of accepting treatment and having this resolved or not having it resolved. When we do this, we're giving them a reason other than price. In general, most dentists believe that price is the reason why people will accept or reject treatment, and they are right. The reason why they're right is dentists, this is the only thing that they are giving them to base their decision on is price. I do this to be able to solve your problem. It's going to cost you this much money, and they may go look and shop somewhere else or whatever it may be, and here it's X dollars, over there it's a little bit less, I'm going to go that route, or I'm not actually seeing that this is worth it, and so I'm not going to accept treatment because I don't feel that I actually need it. As we ask these types of questions, these are questions that no dentist has asked them. They're not getting this type of question asking, and when they're asked these types of questions, they're, again, as I mentioned before, they're coming to conclusions. They're seeing how it's affecting them, not only in their current life, but how it would affect them in terms of these 5 Ps if they were able to have these symptoms alleviated, or be able to have that smile that they want, and it's going to affect them in their employment, in their dating, in their whatever it may be. We need to get to a point of having a little bit more meaning. Once we've drilled down and we've got both their status quo and their vision, then we're to a point in presenting a solution. Now, this solution is not a clinical solution. The solution to them, again, is the benefit to them. As an example, we may say, this is what we're going to be doing clinically. Now, here are the benefits to you. But when I'm talking benefits, we're repeating those things that we're going to be providing to them. You're going to not have any more pain. You're not going to be frustrated at your work. You're not going to have embarrassment when asking somebody out on a date, or whatever that thing may be. And then in doing that, this method, again, is treatment, benefit, and proof. The proof, I mean, this is a situation where we've done this in the past, and this was the result. Dentists in general are really great at having all of these really great proofs or testimonials or before and after pictures. This is a great opportunity or time to use those. And once we're at this point, we then want to make a recommendation. If it's possible to give them some options, people psychologically enjoy having options. When they have options, then they feel like they're in control. And so we'd say, these are the options available to you. This is what I recommend. And then at that point, if we've done our job well, you just be quiet. I want to take you through, this is what's happening from your side of the table or your side of the chair. I want to walk you through really quick what's going on from the patient's side of the table and how it is that they come to decide. You'll start to see as I'm explaining this to you how asking these questions and going through this method is helping them through that decision-making process. This is a 5-step process. The very first thing, and most patients, if you're presenting a case to them, they're probably at this point already, and that they recognize that they have a problem. They need to recognize that there's some issue, either that they have a problem or there's some desired opportunity that they want. And like I said, most patients are already to this point by the time they get to you. The second step that they go through psychologically in making a decision is they need to verbalize the effects of this problem, meaning that they need to tell you out loud how this is affecting them. This is very different than you telling them how this is affecting them or how it will affect them. They need to verbalize it. But if you're telling them, when we're telling people things in general, they will hear a small fraction of it. They will retain even a smaller portion of that, and then they will only believe even a smaller portion of what they've heard and what they've retained. So by them verbalizing it themselves, now they're stating, this is what I believe. They've heard it, they've retained it, and they're telling you this is what they believe. They need to themselves verbalize those effects. And asking these types of questions are allowing them to do that. The third thing that happens psychologically to them in their decision-making process is they need to express concern that things will get worse. And really what I mean by that is that their status quo and their vision are becoming further apart. That either their situation is getting worse or they're getting further away from their desired situation or their desired position. Again, this is something that they need to verbalize themselves. The fourth thing is that they need to have a desire to make a change. We call this need of change, and that you'll know when they're at this point because they will be asking you questions like what can be done, what can we do to fix this. Those are the types of questions that they'll be asking you. What are my options? What can we do? How can we solve this? We don't ever want to talk about money until they're at this point. A lot of times dentists will tell me that a patient right off the bat will essentially self-diagnose and say, this is what I need done, how much is it, how much is it? And if you allow yourself to follow their lead and go to the price, again, that is now the only thing they have to be able to base their decision on is price. We need to divert their attention back and say, I'm not involved in the price, or I'm not sure. I need to find out more about your situation so that we can get to that. We need to get them back on track in this decision-making process. Otherwise, they're going to be at this point of ultimately making a decision before they're ready to make a decision, and the only decision they can make at that point is no. If that's the case and somebody continues to press you on that aspect of price, really all you can do at that point, if you can't get them back on track, is give them the price and pretty much know in your mind that that patient is gone and they're likely not to accept treatment. Curtis, let's go to another poll question before we get to the fifth thing that happens in the decision-making process.
Absolutely, Rob. And this is groundbreaking information. Thank you so much for sharing it. I hope everybody's taking lots of notes and ready to implement these techniques into their office. So our poll question today is, who talks to the patient about the financial? Be honest here. I want you to be honest. I want you to mark down who in your office talks to the patient about finance. And as you're putting this in, think about the things that Rob's mentioned in presenting money, or presenting the cash value is not the answer we want to give them. Presenting the one of the 5 P's, and once again I hope you wrote those down, but presenting one of the 5 P's is very crucial in having the patient accept our treatment. Rob, do you see those numbers there?
Yeah. Hey, and Curtis, I wanted to point out that they can mark all that apply, not only one. It looks like we've got a pretty wide spectrum. Front desk is the majority, doctor being second, other being third. It doesn't. I don't really care who this is. A lot of times dentists will I don't want to use the word deflect, but essentially deflect this to somebody else so they're not having to get involved in those financial conversations, and that's fine, that's okay. Just make sure that in your process that they've got to this point, this fourth step in that decision-making process before you're getting to money, so that they're then ready to accept that. Thanks, Curtis. The fifth thing that happens to them psychologically in making a decision is they are willing to overcome obstacles. And what I mean by this, or they're willing to overcome challenges, and these challenges, again, may be money, maybe fear, maybe time, whatever it may be, that now they're ready to overcome obstacles. And so that's why we don't want to get to the money portion until they're asking, what is it that can be done, or what is it that I can do? As you think back, maybe even on some case presentations that you've done here recently, I'll bet you now you can recognize in a case where somebody has accepted, and you may not have you may not have actually taken them through this decision-making process, but you probably can look back and recognize it. Oh yeah, they saw that they had this issue. They told me how it was affecting them. They were worried about it getting worse. They were asking me, what can I do? What are the options? And because of that, they accepted and were willing to overcome this obstacle of fear or money or whatever it may be. I'm sure that you can recognize that happening within some of those patients where they've accepted treatment. Likewise, I'll bet you can look back to some cases where they have not accepted treatment and see that you probably got to money before they were ready. You likely were telling them how this is affecting them or what's going to happen rather than allowing them to discover it. Again, when we do that, when we're telling them those things, they will only hear a portion, they will only retain a portion of that, and they will only believe a portion of that. When they're saying it themselves, now this is, again, something that they believe, it's something that they're owning, and they're at a point where they're able to make a decision on something other than price. This dentist understands me. This dentist gets why, how what's going on with me. This dentist understands how this is going to benefit me, and they will choose you in those instances rather than choosing somebody else or choosing not to have treatment, because they're now seeing why. What is the reason for accepting this treatment beyond just the financial? Again, it's imperative that you find these key performance indicators, these things that are either contributing to your success or will contribute to your success, and measure these. Again, as I mentioned before, we really like to, in consulting with the dental practices that we work with, we like to not only identify these, but put these into a mechanism where they can see these and be able to know what's happening at a glance. So we've reached the end of our webinar here. Appreciate you spending a few minutes with us. I wanted to point out to you that we've done this same webinar now quite a few times in a row, and every time it's been packed. We've had more people register than we're allowed to have attend here with GoToWebinar. We wanted to extend this offer, and this will be the last time that we do this, that we'll give a free business analysis to the first dentist, the first 10, not that say that they want it, but those that actually schedule an appointment to do this. We normally charge $520 to do this, and in this we can cover case presentations and specifically how it relates to you, run through some scenarios. We can talk about how what key performance indicators are going to be the things that will be the most effective for you to measure and how to measure those things. We can talk about how being proactive with your accounting information can empower you to make decisions rather than just seeing history of what happened. We can talk about tax strategies and how what are some tax strategies that you can implement to be able to minimize your tax before the end of the year. Again, appreciate your time. I'm going to all of this scheduling. If you don't mind, Curtis's contact information is on there. You can email him, call him. If you call our toll-free number to our office, it's probably going to go to voicemail right now, but you can reach Curtis on his cell phone number there, or send him an email, or send him a text, and we'd love to chat with you. I'd love to chat with you about these things. Appreciate your time, and I'll turn this back to Curtis.
Thank you, Rob, and thank you, everybody. Feel free to clap wherever you may be. That was amazing information that we received there. Now, if there's anything you missed or you would like to see again, I'd be happy to send you a copy of this recording, so feel free to email me there. In addition, I will be around for the next hour or so to schedule these appointments with Rob. He has helped out many offices and would be happy to shed any light and give any information to help you as well. Hope you have a wonderful evening, wonderful day, and continue to always succeed and find new ways to better your practice. Once again, thank you, and have a great day.